Chronic inflammation. What really helps? How to reduce chronic inflammation for the general public. Why it matters. Chronic inflammation is something many people hear about, but few really understand. Most people come to this topic because of joint pain, stiffness, fatigue, or long-term health worries. This talk is not medical advice. It's simple education for everyday life. Chronic inflammation is very common in modern lifestyle, but it is not inevitable. The good news is, for many people, inflammation can be reduced by addressing the main drivers, not by chasing dozens of minor causes. Today we'll focus on what really matters, why it matters, and what you can practically do. We'll keep this simple, evidence-based, and reassuring. Compiled by Dr. Siva Navaratnam and ChatGPT, my education partner. I would also like to thank my children, Dinan and Jazara, for helping me in the production of this video. What is chronic inflammation? Inflammation itself is not bad. Chronic inflammation, it is the body's normal defense and repair system. When you cut your skin or get an infection, inflammation helps you heal. That is acute inflammation. The problem is chronic inflammation. Acute inflammation heals and switches off. Chronic inflammation does not switch off and causes slow, silent damage over time. This long-term, low-grade inflammation has been linked to conditions like diabetes, heart disease, and dementia. That's why doctors and scientists now take it seriously. One important point, you often don't feel chronic inflammation. Many people feel normal while damage is happening quietly in the background. This is why understanding what drives chronic inflammation is more important than just treating symptoms. It is the battle between insulin, visceral fat, and inflammation. These three are closely linked. They don't act alone. They worsen each other. When insulin levels spike repeatedly, the body is pushed towards fat storage, especially around the abdomen. That fat is not just storage, it becomes metabolically active. Visceral fat releases inflammatory signals into the bloodstream. These inflammatory signals then make the body more resistant to insulin. So insulin spikes increases inflammation. Inflammation then worsens insulin resistance. This creates a vicious cycle that keeps chronic inflammation going. If we interrupt this cycle, inflammation can come down. Once chronic inflammation starts, it doesn't continue by accident. It is kept going by repeated insulin spikes. Anything that repeatedly raises insulin provides ongoing fuel for inflammation. The most common triggers in modern life are sugar, refined, and ultra-processed foods. Chronic stress also raises insulin and stress hormones, even without food. Physical inactivity makes the body less sensitive to insulin, so levels stay higher for longer. These factors don't act once, they act every day, which is why inflammation becomes chronic. The key point is this: remove the triggers, and inflammation can settle. Now we understand what keeps inflammation going. We move to what actually reduces it. The first and most important step is to reduce insulin spikes. Insulin spikes act like fuel for inflammation. When insulin is high frequency, inflammation stays switched on. Reducing sugar and refined carbohydrates lowers insulin demand. Avoiding ultra-processed foods reduces repeated metabolic stress. Eating fewer well-balanced meals helps insulin return to baseline. Allowing time between meals gives the body a chance to settle and repair. This is not about starving or extreme dieting. It's about reducing frequency and intensity of insulin signals. Food is one of the most important tools we have to calm inflammation. This is not about dieting or counting calories. It's about what the body recognizes as food. Whole, minimally processed foods cause smaller, slower insulin responses. Adequate protein helps with satiety, muscle, and metabolic stability. Natural traditional fats such as olive oil, butter, ghee, nuts, and seeds do not spike insulin and help people stay satisfied between meals. When meals are built this way, insulin spikes reduce naturally and inflammation has a chance to settle down. This approach is simple, sustainable, and works across cultures. Movement is one of the most powerful anti-inflammatory tools we have. It does not need to be intense, painful, or exhausting. Walking daily helps muscles use glucose better, which lowers insulin levels and reduces inflammation. Light resistance training helps preserve muscle, which improves insulin sensitivity and metabolic health. Movement also releases anti-inflammatory signals from muscles. The key message is simple. Move a little, move often, even small amounts, done consistently, make a meaningful difference over time. Sleep is not a passive rest. It is active biological repair. During sleep, the body reduces inflammation and restores immune and metabolic balance. Poor sleep raises stress hormones, especially cortisol. High cortisol worsens insulin resistance and keeps inflammation switched on. Chronic stress has a similar effect. It tells the body to stay in a threat mode. Improving sleep does not mean perfection. Small changes matter. Regular bedtime, less late night screen exposure, a calm wind down routine. The key message for the audience: better sleep is better healing. This slide is about support, not shortcuts. Natural supports that may help reduce chronic inflammation. Many anti-inflammatory compounds come from real foods, especially plant polyphenols and flavonoids. This is why Mediterranean-style diets repeatedly show benefit. Turmeric, curcumin, has anti-inflammatory properties, but absorption is poor unless taken with black pepper and with fat like olive oil. Vitamin D is not a super supplement. It helps if levels are low, particularly for immune balance. Important reassurance for the audience: no supplements can cancel poor sleep, poor diet, or inactivity. Supplements are optional helpers, not the foundation of inflammation control. Chronic inflammation doesn't switch off overnight. It quietens gradually. Blood tests often improve first, lower inflammation markers, and better metabolic numbers. Loss of visceral fat is one of the strongest signs that the inflammatory engine is slowing down. Many people notice something simple but powerful: less joint pains, less stiffness, easier movement. Important reassurance for the audience: you don't need perfection, you need progress. Improvement across several small signs together is more meaningful than any single test. Chronic inflammation is not something you fight aggressively. It settles when the body is treated kindly and consistently. As inflammation reduces, people often describe less pain, more energy, better sleep, a general sense that the body is less reactive. This doesn't require perfection. It requires steady, repeated habits. Small daily choices: calm insulin signals, reduce visceral fat, and allow the body's natural repair systems to work again. Your body wants to heal. You just need to stop triggering it. Thank you for watching.